Hello, welcome to the Canine HS Bite-Sized Canine Anatomy, and we're looking at the scapulothoracic joint, and it's such an exciting joint that's so often overlooked or not really thought about, but it's the key to really encouraging natural balance motion in the dog. So if you're concerned with improving motion in a dog, this is the one for you. It will tie in with the other ones we've been doing. So just welcome to everyone. We've got such a huge audience. It's fantastic. The crowdcast is a bit laggy, so there may be a slight delay with my lips and syncing as well because of the high use. But we've got people coming in from everywhere worldwide, and it's so wonderful to greet you to another bite-sized canine anatomy, and I'm super excited about this one. Sarah very kindly is running the chat, so thank you so much, Sarah. She's doing that remotely. I'm going to be going through the PowerPoint and discussing some really top clinical tips. I'll give you some forewarnings, so please make sure you've got pen and paper. They're not included in the script. It's just in our discussion. If you've got any questions, you can post them in Ask a Question along the bottom navigation bar. Just pop them in there and I'll make sure that we discuss those as well. But welcome everyone. We've had a beautiful sunny day here in the UK. I know we've got people in from Canada, New Zealand, Australia, South Africa, Thailand. So if I've missed your country out, France as well, tag it up, use the chat, and please let's share in that chat because it's such difficult times. So it would be great to universally across this community share worldwide. So I'm just going to go to the first slide, bringing that up. So I'm really conscious with what's going on, and we've got an incredibly exciting new initiative to announce in our next Bite-Size live event. You have to wait till then, but we've got some really exciting offers as well. So it's just to kind of tie this series up and start linking it together. And I really believe that the scapulothoracic joint is going to answer a lot of queries that you may have had. So we're just going into the slides. So why am I so excited? Let's deep dive into the facts, because there's not a lot about it in articles, in literature, but the biomechanists I've had the joy and privilege to work with, the professors at the Royal Veterinary College, that just got me so excited about canine biomechanic design, which is totally different to human, totally different to the horse, totally different to other mammals like badgers and bears. So having this understanding of this unique biomechanical model is going to empower your treatment choices and really help you understand, which areas you need to develop or go forward with. So the scapulothoracic joint, this is a synsarcotic joint. Get this, it's between the costal surfaces or the medial surface of the scapular bone and the thorax, the chest of the wall. So it's really important that you kind of go through this information with the understanding of the shoulder joint, which we've already covered in a past bite-size. So it may be well for you to go and review some of that. I don't want to repeat information. I want to give you something new and exciting to tie into that as well. And I get so excited about this joint because when you understand the biomechanics, this is where all the massively important information and movements happening with the forelimb. So the canine scapula, it's a large, flat, triangular bone. It's got 3 borders, 3 angles, and 2 surfaces. So the 3 angles, the thickest one is the acute one, which is down along the bottom, and that's your ventral angle of the scapula. And the cavity of the ventral angle makes the glenoid cavity for this synovial shoulder joint. And exceptionally unusual, it's only in the dog, the glenoid cavity articular surface extends up and includes the supraglenoid tubercle. So with the dog, the supraglenoid tubercle, which is where biceps brachii attaches, is intra-articular. And that's really relevant for clinicians, which we've covered in the shoulder joint and in biceps as well, in biceps brachii. So do go and have a look at those. All the bite-size series that we've launched and been processing through and sharing with you are all available on replay on our YouTube channel, Canine HS. We get the replay up as quick as we can, and you can watch those on there. So you don't need to have been at the live event. The advantage of the live event, and welcome to so many people who've signed in today, giving up your time on a Sunday evening at 7 o'clock British summertime, is that you can ask questions, you can be interactive with each other, and I think that's so important that we can have discussion. So the three borders, we've got the dorsal border, which is the thickest of the three borders, which is along the top. We've got the cranial border of the scapula, which in the dog is quite thin, and the caudal border. And now we've got two surfaces. So we've got the lateral aspect, the lateral surface, which you can see on the left-hand picture. And then you've got the medial surface, which is slightly concave. And that's also known as the costal aspect of the scapula. So this is making half of the scapulothoracic joint. So if you look at the lateral aspect, you can see it's divided by a very prominent spine in the dog, and that's bisecting that, and it's ending ventrally lower down in the acromion, which is an enlarged knob. And an enlarged knob means something really important attaches to that. So attaching to the acromion and to the spine of the scapula is a muscle called deltoid. Now, deltoid is not an extrinsic muscle, it's an intrinsic muscle, and it's a shoulder flexor in the dog. So the spine only has three muscles that attach to it, and deltoid is one of them, but it's not an extrinsic muscle. So here comes the exciting facts. The scapula is attached to the thorax, to the dog, through an integrated muscular sling. It has no bony union, it has no bony joint, and that means the design is superb for scapular gliding. And why is that relevant? We're going to look at that in a couple of slides' time. So we've got three angles. The cranial angle in the dog is curved, so quite hard to feel. And in the cats, the scapula is a different shape entirely. It looks like a butterfly wing. And anything else about this? So the spine divides the lateral border of the scapula into two fossa. You've got the supraspinous fossa and the intraspinous fossa. Supraspinous, above and more cranial, which is where supraspinatus, the muscle, arises from. And we covered that in the shoulder joint because its main function is stability and giving stability to the lateral aspect of the canine shoulder joint. And infraspinous fossa is where infraspinatus arises. And again, that short, stubby, thick tendon is fused along with supraspinatus to the shoulder joint capsule, acting like a collateral ligament, but it's not a ligament, it's a tendon of a muscle. So all of this is integrated. So you've got to look at your shoulder joint and the scapulothoracic joint. Medial to your supraglenoid tubercle. So the supraglenoid tubercle is right down on the ventral angle. That's where biceps brachii attaches. And medial to the supraglenoid tubercle is a little process called the coracoid process. And that's where coracobrachialis attaches. It's another muscle. It's got a really interesting design of a tendon, small muscle, longer tendon, because it's superficial to subscapularis, and it crosses it like a cross, like that. So we could deduce that coracobrachialis, it's deep and it's medially placed, but it's superficial to subscapularis tendon, could be acting also to support that medial aspect of the synovial shoulder joint. And subscapularis arises from, if you can see, I don't know if you can see my arrow, the bottom 2/3 of this costal surface is where subscapularis muscle arises from. And the top third is serrated and roughened. And the top third of the costal surface here is where an incredibly important extrinsic muscle attaches to, and that's serratus ventralis. Now, serratus ventralis, if you think of it attaching there and like fingers fanning out ventrally, then attaches to the cervical and thoracic spinous processes and the thorax, literally suspends the thorax between the forelimbs, and the limbs are suspended hanging off there because there's no bony union. So this is why it's so exciting, because it's absolutely instrumental in range of motion and speed. you know, for dogs is very important in the athletic dog, and also range of motion is very important functionally for the dog. So looking at this scapulothoracic joint, we know it's a synsarcotic joint. It's literally the forelimb is attached to the dog's body through muscle. So what this means is, depending on what the muscles do in that arrangement, you are not going to have a static position of the scapula fixed there. It is going to be moving. So depending on what muscles are doing what, it's going to be gliding over that thorax. So this is where we've got to dispel this myth of a well laid back scapula. It's going to be really dependent on the breed. So we know that little terriers, short legs, short humeri, have a higher stride frequency, and they've got little choppy kind of movement, and their dorsal borders of their scapula are really cranially placed, and that's normal for them. So I think sometimes general information comes from other species and people just listen to it and think that's what the dog's going on about as well. That's not the case. The scapula, you can see the scapulae together lay in the sagittal plane. This dog is designed with 4 legs to support it against gravity. So we need some anti-gravity muscles in an extensor sequence, and to organize movement and accelerate forwards. This dog is not designed to do other movements. I've never seen a dog walking sideways. I've never seen it going backwards. I've never seen it in some of these kind of exercises that people are asking dogs to do, move like that naturally for their normal sequencing that they need each day. And definitely, if you work outside the biomechanical design, the facts are you will break down the system quicker. So with complex training techniques where you're asking the dog to move outside of its design, your injury rate is going to be significantly higher. Whereas the dog sequences that they need every day, if we work with those and use proprioceptive enriched activities like movement enrichment techniques, we're going to see a profound improvement within the session, never mind across a few sessions. So really, the whole bite-sized canine anatomy series is to help empower your choices for the treatment techniques you're going to use. And if we're going to talk about proprioceptive enriched exercises in the dog, we need to work within the design to have a profoundly impactful and positive outcome, rather than following prescriptive exercises with poles, wooden blocks, which, by the way, cause a lot of hock injuries. Moving sideways, moving backwards, moving upside down, wheelbarrowing. Those are neurological tests. Let's not take those kind of activities into the therapeutic world, because you will not get the results you will get, you know, if you're not using movement enrichment, therapeutic handling, movement shaping, alignment techniques, embodying a whole series of different approaches to get the dog to move normally and functionally within its design. So the ventral, if you're looking at the scapula, this is a really important point as well. The spine, when they're born, and in smaller dogs, not less well-muscled dogs, but just smaller dogs, tends to just arise out of that blade. So, you know, the common name for the scapula is the blade bone for a reason. Now, in your well-muscled larger dogs, we know that's the spine of the scapula comes up and literally curves caudally from the pull of the muscles on it. So we need to understand different breeds are going to have different positions. Dogs in different states of behavior will have different positions, and different conformation. We're going to have different positions of the scapula. We cannot generically, for this species, say it needs to be in this position for good movement. That's not the case. So in real life, the scapula is extended with a scapular cartilage. Now, in the dog and the cat, it's quite a narrow band of cartilage, but in the horse, it's huge. And again, understanding your species difference. And so what this does is extends the surface for muscle attachment and also helps the scapula fit the thorax wall as its scapula glides around. So this is just to really excite you. And the muscle that attaches to the scapular cartilage and the medial aspect of the dorsal border is rhomboids. Now, I know it says rhomboideus. You can call it what you want. I learned it as rhomboids, but trying to be particularly factual, it is the rhomboideus muscle. So let's think of these biomechanics that I keep repeating in most of these series. And just to try and get you really thinking about this, we know biomechanically we have models of design. And the design I want you to consider and think about is an inverted pendulum model. So if you put your elbows on the table, so I've got my elbow on the table or in your cup of your hand, and make a fist. Now just move your fist from side to side, keeping your elbow still on the table or in your hand. And what this is it's like a grandfather clock pendulum, and you just invert it, you tip it upside down. Now your fist is the scapulothoracic joint, and that's where the movement's happening at the forelimb. You have very little range of motion happening at the carpus, at the elbow, not that much at the shoulder. The scapulothoracic can be incredibly significant to improve performance, but also really important for high quality movement. So those wonderful elderly dogs struggling, you can do some fantastic techniques, both land-based and water-based, to improve the quality of the dog's movement. It's an efficient design feature, and the motion is happening at that scapulothoracic joint combined with the shoulder joint. It's not just the shoulder joint. And this is what gets so exciting, really, to share this with you. This is gleaned from multiple articles, papers, and working with the top biomechanists, and having the fortune and the privilege to work with some amazing professors to help me understand this and relate this from a clinical context. So here comes the really big thing coming up. So I'm going to go back to the past slide. Range of motion, physiologically, it's not just a scapular glide. It's a glide and rotation. It's a combined glide and rotation. And it's linked to forelimb protraction and forelimb retraction. So the function of the scapulothoracic joint is to increase the stride length of the dog. And it's also incredibly brilliant to be a braking and shock absorbing joint. It absorbs the forces that the dog goes through. And we've got 60% of the dog's mass going through the forequarters. So its main function, this huge integrated muscle tire or muscle shape, if you think around the dog, is all about braking and shock absorbing and increasing the stride length of the dog. Now, this should get the therapist really excited. We know that stride length times stride frequency is speed. Now, stride frequency, obviously, for someone short like myself, walking next to someone tall, I have a higher stride frequency than the person who's taller than me. Little terriers have quite a high frequency, choppy, because they've got an upright scapula, which is normal for them. That's their conformational design, okay? Whereas a larger dog will have a slightly longer stride length and is going to have a lower stride frequency, because it's all about the leg length as well. So what we know is stride frequency increases with walking. So as you walk faster, you've got a higher frequency, and then you move into trot. And then as you get faster in trot as a dog, the stride frequency is going to increase. And this is the clinical tip. Now, just think of this. The frequency then levels out. The only thing that's going to increase speed is stride length, and stride length is definitely affected by the scapulothoracic joint function. So this is really exciting. Let's go back and just think about that pendulum. Now we're going to look at protraction and retraction, and I want you to really focus, have it in your mind, get an image in your mind. This combined scapular glide and rotation happens simultaneously. They don't have a clavicle. They have a vestigial coracoid process. It's totally different to human movement. So don't relate it to your knowledge of other species. Let's get down and give this wonderful species the attention that they need. So protraction, there's a lot in the industry at the moment about protraction and flexion. Okay, so what's the purpose of protraction? This is swinging the limb forwards, okay, to get ready for retraction. Retraction is what counts, because that's where you get your power sweep. There's no power sweep in protraction. It's not weight bearing. It's moving forwards, priming the muscles. So the protractors in the dog are going to be brachycephalicus, huge muscle, maybe omotransversaris coming in there, but that's got a lot to do with side flexion of the head as well. And in the picture on the right is passive range of motion. Now, come on, therapists, you know passive range of motion is useful, but there's nothing that can beat a proprioceptive, enriched, active range of motion that the dog participates and is guided to do. This is not a training technique. This is not learning to do an activity like going over poles. This is the dog moving in its natural balance motion, which it does most of the time, every day of its life. And this is when they come and the owners say they're struggling to get up, they're struggling to walk as far, they're struggling with stairs or turns. This is where we need to bring in a range of proprioceptively movement-enriched treatment techniques to improve those sequences. So protraction is the cranial movement of the limb on the axial skeleton. It's about getting ready for loading. And what breaks protraction is going to be your antagonist muscle group, your retractors, which is latissimus dorsi. Now, we've covered latissimus dorsi in depth. Go and have another look at it. It's so exciting because a lot of people in the feedback hadn't realized its integrated work with the pectorals muscles and maybe haven't realized how important it is as an extrinsic muscle as part of this hugely important scapulothoracic joint. So have another look at that one. So retraction, this is where the magic happens. Retraction starts at the end of protraction, which is being braked by the antagonistic muscles, the retractors, and retraction will start. So you'll have an EMG reading of latissimus dorsi, there'll be a burst there. Now this is a swing design, so the muscles don't have to work every moment of that movement, which is brilliant for efficiency. So this is where your inverted pendulum comes in. So it starts the movement and then you're going to have early stance, mid stance, and from mid stance to push off is the power sweep against the ground. That's where the power of movement happens from. So that's where we want to focus. It isn't about focusing on how far it goes. We want it to be efficient. We don't want to be relying on passive range of motion. We want active range of motion. So we need to think how we can activate these very important muscles with guidance, and that's through movement enrichment techniques. The other thing is I want you to remember protraction and retraction can happen in stand, sit, and side lying as well. It can be in lots of different positions. The reason I've put this picture in here, lovely picture of Lily on the right, is because she's looking towards the camera. Now, if you retract the limb and she turns her head, you are going to activate brachiocephalicus, sternocephalicus, and omotransverse areas. So understanding your neutral position you're working in, using therapeutic handling, therapeutic touch and holds, and then guiding and commanding a really proprioceptive, enriched movement is hugely beneficial to the dogs to improve their movement dynamically and statically, pretty much immediately. So retraction is this caudal movement of the limb on the axial skeleton. It's the power sweep of movement. It generates the power to move the dog forward in the sagittal plane. It's limited. It can't just keep going on, and we don't want it to. It's going to be limited by the antagonistic group, which will be the protractors. So, biggest clinical tip of all time coming up now. As the limb is protracted, the scapula is going to glide cranially, but it's going to rotate. Now I have a thing. If this is hard for you to hear, visualize you're above the dog, you've got your middle finger on the spine of the scapula. As the dog protracts, the glide is cranial glide, but it's going to rotate ventrally at the same time. It's a combined movement. So the scapula doesn't just glide cranially, it's going to glide cranially as you protract, and the scapula is going to rotate ventrally. And it's going to, so imagine the pendulum, you've got the pendulum, all right? So you're starting on the left side, the pendulum is there with your fist. So as you protract, the paw's coming forwards, so you are going to glide cranially, but you are going to rotate ventrally. Now, please, please, please do not take this information and decide you are now accomplished to do manipulation techniques, mobilization techniques. You know, stay within your scope of practice. But if you understand this concept, you should be getting very excited about knowing which muscles to target to increase performance, which muscles to target to increase the quality of forelimb movement. So let's reverse that. The most important movement is the power sweep. When the dog retracts, so the limbs coming forwards, the scapula is going to glide caudally, but it's going to rotate dorsally, that way. So let's try that again. So you've got your pendulum there. When the dog retracts, that's going, the limbs going backwards, okay? The scapula glides caudally, but it rotates. And so what people do is they make it simplistic. They describe this rotational and glide movement as just a glide. And so they're going, oh, it's going cranial or caudal. It's so much more than that. So if you understand what muscles attach where, we can have a profound effect at the efficiency of the scapulothoracic joint, which is so important for the dogs. Let's move on. I can't help getting excited about this. It's so thrilling to share this with you. So now we're going to look at this thoracic sling of muscles. I've got a bite-sized half hour here. I can give you an outline. I can't give you the detail, but the muscles that we need to think are the extrinsic muscles. So your extrinsic muscles are going to be trapezius and rhomboids, which make the top of the muscular sling. And you're going to have latissimus dorsi, which we've looked at in depth. So go and have another look at that. We've got brachycephalicus. We've got omotransversarius. Now, I'm going to show you in a moment where those are and get you a bit orientated. But we've also got the superficial and deep pectorals, and they act like a sling, like a hammock underneath. And this whole amazing thoracic sling of muscle works integrated. And then the key, serratus ventralis, from that costal surface on the top third, literally fans out ventrally, like that, fans out ventrally to attach to the cervical and thoracic spines. And that is a sling to support the thorax over the forelimbs. And the forelimbs are hung off that. So it's incredibly exciting. So let's have a look at some of these muscles. The reason I've picked a few out is because they've been mentioned by people in past bite-size canine anatomy sort of sessions. So I just want to get really excited. Trapezius. In the picture, can you see trapezius is denoted by the orange arrow? It's got two parts. It's thin, it's triangular, it's just under the skin, and it attaches to the spine. Only 3 muscles attach to the spine of the scapula in the dog, okay? And you can see it's got a cervical portion and a thoracic portion. Now, I have yet to see a horse or a dog chuckle. I don't see them elevating their shoulders, having a laugh. Never seen it apart from in a cartoon. So when you read the anatomy text and it's talking about elevation and depression, it's more about keeping that scapula in play so it can efficiently glide. Now, where you will see elevation is going to be when you see a border collie go and creep. You will see the scapulae elevate and they'll go down into a creep. Now, other breeds in this species don't do that. You may see it in, say, ectomorphic dog, like a greyhound, ectomorphic kind of body shape, long legs, and they separate their forelegs to go down to eat or to drink. There may be an element there. But actually, these muscles are all about supporting the thorax between the forelimbs and being a brake and shock absorber. That's their main function. Those other little bits, they can all do with those as well, but they are very, very important about increasing the range of motion for the dog's forelimb. So trapezius extends from C3 and it goes all the way to T9. So we can see that with this orange diagram here. Sorry, it's a bit faint there. Okay, and it's inserted onto the spinal scapula. The other muscle that I've put in this picture that Sarah so kindly did for me is deltoid. Deltoid is not an extrinsic muscle. I just want you to understand that's literally under the skin. So you've got trapezius and then deltoid, you've got the scapular part and you've got the acromial part. That's an intrinsic muscle. It's nothing to do with this muscle thoracic sling, but I want you to understand that just under the skin when you palpate, that's what you're palpating. You are not palpating supraspinatus and infraspinatus. They are deep, deep, deep. They are stabilizers of the shoulder joint. You do not palpate them when you palpate this area. You palpate deltoid, trapezius. Now, omotransversarius, you can palpate in the lower third of the cranial aspect of the spine, of the scapula, just a small amount before it tucks under this huge muscle here, which is brachycephalicus. So omotransverse areas, it goes up to the atlas, C1, which is atypical, and it's laying above the transverse processes, and it's a long strap-like muscle. And in another bite size, I'll explain the architecture of muscle, why it's so important that the protractors have long parallel muscles like in a series, and why your retractors and your power muscles have the architecture they need, and why the stabilizing structures have their architecture, because within the way that they lay their muscle fibers determines what their ideal key action is. So what's underneath trapezius? If we flap trapezius up, which we showed in the latissimus dorsi bite size, is rhomboids. So rhomboids lies deep to trapezius. Okay, now the thing I have to flag up about rhomboids, people get ever so excited they found a trigger point. There's a really big fascial tie between the cervical and the thoracic parts of rhomboids. It's not a trigger point, it's part of the anatomy. So again, really think about what you're palpating rather than what you're trying to find. So it's deep to trapezius. Okay, it's got 3 parts. This is very exciting. Not only has it got a cervical and thoracic, it's got an occipital part. That means that you can impact the neck for neck issues by doing some scapulothoracic movement. Think of that. So the occipital part, it's a long strap-like part, and we've used red pipe cleaners here to kind of denote that. And that comes from about C4 and it goes upwards cranial to the occiput. Then we've got the cervical part, which extends from C2 or 3 over to about T3. Then we have a huge fascial tie within that muscle. And then we go to the thoracic part that goes from about T3, 4 to T7 and 8. And it's covered by latissimus dorsi. So if you go back and have a look at latissimus dorsi, you will see a lot of these muscles overlap a corner of the scapula. And their function is to keep that scapular glide in play. It's about securing that so it works efficiently. So it's really exciting how all these different canine bite sides overlap each other. So have a hunt through them, go back and just check some of them out. And again, as I said, this inserts on the scapular cartilage and the medial border of the scapula. Okay, so it's the medial dorsal border of the scapula. Obviously, if you're palpating, you have to be medial to the dorsal border of the scapula, and you've got to be really mindful. This is a deep muscle. Let's not hurt the dogs with our purposeful palpation. There's a much better way to do that with movement enrichment and therapeutic touch and therapeutic handling. We can gain the consent of the dog and gain the consent of the soft tissue to allow us and give us permission to go deep. You don't get that by just pushing into these muscles. All they'll do is just lock up and spring you out and say no. So there is a really specific therapeutic assessment technique you need to know for analysing tissue in the dog to get an accurate and valid result, to then make a really informed choice on what therapeutic treatment technique you're going to use. Hopefully, you're going to embrace working with the dog and using canine movement enrichment treatment techniques, which is about connecting with the dog's tissue, working with the dog, understanding their behavior in the context of your clinic, and using proprioceptive enriched activities, exercises, and movement sequences that are relevant to the dog, not just doing them because they're proprioceptively enriched. Work within that design, minimize the injury you're going to cause to the dog, please. So let's think about the pectorals. Well, we're nearly there. So again, like I said, a hammock. So my hand on the left, my hand is signifying the superficial pectorals. There's 2. There's a descending. So you can see my hand's descending down. It's thicker at the top. My fingertips are a little bit narrow. That's like the superficial pectorals. And then deep to the descending is the transverse. So it's got 2 parts. It covers biceps brachii. It's the muscle just under the skin. So you're going to feel that. And then the deep pectoral is my hand on the right. That's coming from the ventral part of the sternum and upwards. So that's called the ascending part. And that is deep to superficial. So it makes this hammock. Now, in dogs that are sled dogs, dogs that pull because that's their breeding and that's what they've been bred for, they're going to be very well developed and hypertrophied. What we don't want We don't want to use a harness, whether it's a Y-shaped harness or any kind of harness that encourages the dog to pull. So I saw some footage about harnesses and I was really, really concerned because they had a taut strap on the back of the harness behind the dog and the dog was pulling into it as they were moving in a treadmill. That's not the function we want. We want the dog to move in balance, and that's why we use 2 points of control. It's about the dog finding their natural canine balance and then working dynamically in that so they're in natural balanced motion. It's not about how much a dog can pull, because by pulling, they're taking themselves out of natural canine balanced motion, which is efficient, and it switches on all the sequences, so they work really, really well. So have a think of that, and then when you put a collar on a lead, a collar on the dog as well, it's very easy to take the dog out of balance, so easy. So you can use a collar and a harness, but using a Y-shaped harness to encourage natural canine balanced motion is key to fast, successful treatment techniques that are long lasting for the dog, because you're hooking into how they're designed. So I want you to consider the consent of the dog to your palpation. Work with the dog's consent, work with the soft tissue consent. Don't push through and be hard. The dog's tone, we know, their emotions and their behaviors in their clinic will command what their muscle tone is like. You will change the muscle tension from your behaviors and how you set the clinic up. So using clinic enrichment techniques helps the dog to be focused, confident, calm, and work with you rather than trying to get back to their owner or pull out of your hands. We need the dog's consent to work to make sure our palpation is accurate. We've got to think about the dog's behaviors. So we're working with the dog, but we're guiding their movements and we're commanding natural balance motion at every opportunity. We also want to think about the structural positioning of this joint. So the scapular thoracic joint is attached to the body of the dog, the thorax, through muscles. So clearly what muscles are activating, it's going to be a dynamic movement. The scapula is never held in one position. It's always on the move because there's no bony union. So it's clearly the structural positioning of the scapula is going to very much depend on the dog's behaviors in the clinic and how you're working with the dog. So please don't do techniques onto the dog. And we need to think about the relevance of your choices. This is all about empowering your choice. Why are you doing this treatment technique? Not because it's just been in a course, it's on social media, someone else does it. You want to do it because it's in the best interests of the dog's biomechanical design and their canine behaviors within your clinic to get the best outcomes for the wonderful dogs in your care. And clearly, what you're going to do with a wonderful elderly dog, a senior dog, cannot remotely be anything like what you're going to do with a young, fit, athletic dog. Okay, so again, it's about this unique individual program you're going to devise for each dog. We want to have accurate palpation. We want to have valid and reliable assessment techniques. So we have a sound body to critically think and clinically reason your problem list, your SMART goal setting, and then your treatment techniques, whether you're working on land, in water, or integrated practice. And again, it's just showing on the left, the thumbs are resting on the dorsal boards of the scapulae. When you're, you can see it's in the sagittal plane. You can see how far forward they are on this lovely little terrier, where they wouldn't be in that position in another breed. And you can also see they're a narrower fit, your thumbs, than when you're feeling the tuberous sacralis. So again, go back and have a look at the gluteals and the hip joint bite size and see the distance that you're working at. But they work in the sagittal plane. The dog is designed to move forwards. Please, please, please do not think you're doing proprioceptive enriched activities and take the dog backwards. We're seeing more and more caudal cruciate ligament issues. And the caudal cruciate ligament is put under undue stress and strain if you walk a dog backwards. And I've never had a dog walk backwards to me. They walk forwards. So don't take them out of their biomechanical design. Please don't raise the risk of injury because someone's directed it. Really search this information, search the literature, make your own mind up. So any questions? We've got 3 questions sitting there, which is fantastic. Sorry, I'm sorry if I've spoken quite quickly, just so passionate about this joint. There's so little about it when you're having a look in the literature, and it's so key to movement of the dog. You know, we want to increase the range of motion. We want to increase the stride length. It's fantastic knowledge for the young, fit athlete. It's fantastic knowledge for the senior dog. And I'm so excited because this week we've just finished the level 4 senior dog unit for the level 4 diploma in canine hydrotherapy. The senior dog course, it's each unit is like a mini course, and you can just do one as a CPD, and it is the most satisfying and awesome unit I have written for years and years and years, because I am so passionate about the senior dog. I am so passionate about using movement enrichment techniques and seeing dramatic improvement in their daily lives. And honestly, it's just, I cannot tell you, we put so much, we have stuffed this unit full of information. It's such an exciting unit to do. So let's have a look at those questions. We've got 4 questions now. So we timestamp the questions. So please, can you not vote at the moment? And the first question's from Jeanette. Hello, Jeanette, welcome. So Barbara and Sarah, would you recommend any anatomy models which would help understand these joints? I think that's a really good question. I think it depends how you work. For me, I'm very much a hands-on, very much a visual learner. So I like charts, but I'm also, for me being dyslexic, I like 3D. Once I work it out in 3D, it makes sense to me. So if you can get yourself a small canine anatomy model and then start putting the muscles in like on different colored string and put them on their origin and insertion and put them either deep or superficial, I find for me that works really well. I can really understand where they lie. And then the other thing I find really useful is that I like to chunk it down. So I look at everything around one joint, and I tend to use a watermark of one of my favorite breeds, and then I will focus in and enlarge that joint. And then what I will do is I will have tracing paper with my deep muscles. I'll have tracing paper on top with my superficial muscles. So I can kind of flick it up and down. And I find that really works for me. So I think the more you understand each joint and the muscles that go over more than one joint and how it all fits together. But today is about an outline of the scapulothoracic joint, and it works in unison with the shoulder joint. And its scapular glide is so exciting to understand and so relevant to our clinical choices, but it's a little bit more complicated than some of the texts make out. It's not just a glide, it's a glide and a rotation in one. And I think a lot of people hop from one species to the other and feel it's similar. You've got to know the dog stuff. You really have. The dogs are worth it. I hope that helps, Jeanette. Yasmin Elizabeth, hello, welcome. I'm just going to answer your question. So I'll read it out first. If the muscles around the scapula are affected, by example, due to lameness on a forelimb, and that impacts the muscular when palpating and comparing left to right, will there be a palpable difference, asymmetry between the positions of each scapula? Brilliant question. We're going to present this in another bite-sized canine anatomy, and we're thinking of developing it with some assessment techniques. But absolutely, if the dog is focused, calm, and working with you, and you're using your therapeutic handling to get them to be focused in a neutral, balanced stance, and you then place your thumbs on the dorsal borders of the scapulae, you can differentiate if it's something going on in the neck, if it's something on the thoracic sling, or if it's a shoulder joint issue, by understanding which bony landmarks to hunt, measure between, and looking at the position of the dorsal borders of the scapulae, whether they are ventrally or dorsally, cranially or caudally, or in an abnormal position. And that's just one of many assessments you need to do to get the complete picture, because you need to rule out it's not the shoulder joint as well, which is a whole other bite size in there. But I hope that helps you, Yasmin. Absolutely, you're onto a great thing there. Well done. Jeanette, I've got another question from you. Thank you very much, Jeanette. I've time-stamped it. Do you have any brands for the Y-shaped harnesses? Well, if dogs were like horses or people, just sizing differences, so smaller or larger, that would be easy. We would always have one. But dogs are amazing. We have got St. Bernards, and we have got mini Daxies, and we've got Welsh Corgis. So it's not just sizing issue, it's conformational differences. And we need to have specific Y-shaped harnesses for different conformations. So I don't recommend one brand over the other, but I have them all and I find the very best fit. So it's not just the Y-shaped harness. It needs to be fitted, and that's definitely a service you can offer as a therapist, having a really good fit of the Y-shaped harness for the dog to optimize their protraction and retraction. What I find very difficult to understand is why people use any kind of harness that comes across the front, because what you're doing is limiting protraction. That's not going to help the dog. That actually hinders the dog's progress. The only way they've got to accommodate now is to bunch up their spine, overload their lumbosacral junction. So I would prefer to have a dog that's in balance, but we rectify protraction and retraction in balance. I will bring them back into balance rather than restricting movement. So I really do not like what happens to the dog biomechanically with any kind of harness that comes across and restricts any kind of that protraction, retraction swing. The retraction works because the protraction is working efficiently. So it's a combined movement, but that's a great question, Jeanette. Get them all. Right, so Sandrine, thank you, hello. So Barbara, the question is, Barbara, how do you manage very heavy dogs like dog of Bordeaux in the pool, please? Well, we staff up, it's really important. So particularly with what's going on at the moment as well, thinking about our protocols, dynamic risk assessment, our risk assessment for when we do open, we're definitely changing our staffing levels. And for a dog like that, we would definitely have 2 therapists. If it was a dog that I knew really well, trusted, had confidence in me, and my relationship with the dog had built to that point, it may be myself and a rehab assistant. But if it was for the first time in the pool and a new experience and it's a large dog, definitely 2 highly skilled therapists working with the dog to make sure that it's a calm, focused session and that we optimize the impact of that experience. So it's a very positive experience for the dog. I hope that helps. We've got some more questions coming in. So this is from Samantha. Hello, Samantha, welcome to you. So the question is, following a forelimb amputation that includes the scapula, gosh, that's huge, on the opposite forelimb, the scapulothoracic joint, do you tend to find the rotation movement significantly decreases or increases to give enhanced stability? So let me understand this, Samantha. Please do give me a little bit of extra information in the chat. You're saying that we've got a tripaw with a forelimb amputation that includes the scapula. So all we've got is the thorax and the skin tucked up around it, which is a horrific amputation to deal with. So if you did have a stump there, it's incredibly important to mobilize that stump to get those muscles working. So just thinking about that, so the other scapulothoracic joint is now working by itself. It's going to have a very adaptive movement pattern. It's almost going to have like a hop pattern as well. The whole limb is going to alter its dynamics, and possibly you're going to start finding a huge stress on the carpus because the alignment of that limb will alter as it moves it across, because it's got to support the same mass. It really depends on the breed as well, if it's a slight breed, an ectomorphic body. But that's something that I can talk to you in depth, Sam, if you would like. So just PM me and we could go through that particular case. We see a lot of tripaws, forelimb and hind limb. So I can definitely share that. And getting a really well-fitted harness for that is difficult as well. So let's think about some movement enrichment techniques that we can do, some awesome things that we can do to get that movement optimized. I hope that helps, Samantha. And the last question I've got here is there a time limit that previous bite-sized anatomy replays will be available? No, I do these for free. I do this to share with the industry, to share and get you excited, Sally. Thank you, Sally, for that question. They're on YouTube. They stay on YouTube. They're free. They're on replay. So the bite-sized canine anatomy series we've been doing this year, and we've then been putting on YouTube. So the replays on YouTube, there's no finite time. They're not being taken down. They will sit there on our YouTube. And the more you subscribe and like our videos on YouTube, the more we're going to do. It's as simple as that. So I think that's all the questions. So I've got one more slide here just to talk about a couple of things, because I've had a lot of questions this week. And I'll just bring up this link for you. There we go. There's a link there. People are saying, what are canine technical videos? Are they just video links? They're so much more than that. So we have devised over a number of years, and I'm thrilled because the ones in the senior dog were with a dog that I was incredibly fond of, who was a wonderful age. And then, unfortunately, he went to Rainbow Bridge, and I couldn't edit them anymore, and I couldn't do the voiceovers. And that's what's been so exciting. Actually, we've just finished 6 amazing canine technical videos, and what they are, instructional manuals showing us doing the techniques in the clinic step by step, and then a breakout session into a workshop style to break down that technique and show you the detailed parts of that technique. So they're like an instructional manual for different aspects. So our canine TVs are unique to us. They were inspired years ago by something I saw, and I thought, wouldn't it be awesome to bring a visual canine manual into learning? So please, please, please do give me feedback if you're enjoying these. It gives us the motivation to keep going. So I want to tell you about our bite-sized short courses. So on the homepage of the website, I have got 3 bite-sized short courses. They're refreshers. They're for people who want to know more about movement enrichment techniques for dogs. They're people who want to find about clinic enrichment techniques and therapeutic handling techniques, how to put in a highly proprioceptive, enriched program from the moment the dog walks into your clinic to the moment they leave, and see dramatic effects. And these are land-based techniques and water-based techniques. So there's something there for everybody. They are 6 hours. So therapeutic handling techniques for canine therapists probably doesn't quite tell you that it's so packed full of instructional videos. And it covers therapeutic touch, therapeutic holds, therapeutic lifts, movement shaping, alignment techniques, clinic enrichment techniques for canine therapists. So they're like a refresher course for people who've maybe done some other training with us or maybe haven't come across this. This is how you can enrich your clinic by what you do in it. It's not just about making yellow brick roads or pathways for dogs. It's about what you do within that environment, and it is proprioceptively enriched, and it's proven. And you will dramatically improve your dog's movement by therapeutically putting on the harness rather than just putting it on. So we bring therapeutic touch, therapeutic holds, clinic enrichment techniques, and all these treatment techniques to you in visual videos. And you can watch them as many times as you want. You have a year's access to the course. We have reduced the prices of all these courses at this time, and they are completely online. You don't have to, with these courses, come and see us. Everything is online. They are certificated, they're approved by IRVAP, and they are approved through the ABC Awards QLS. So they are recognized as well. And the canine natural balance motion sits at a slightly, it's got a little bit more detail in there. So that's for people in practice who maybe want to delve into that. That's a little bit longer, that's 10 hours. And there's a huge amount of video links, downloadable PDFs, tasks, support, guidance. So if you're interested in working with the dog and finding out about appropriate canine proprioceptive enriched treatment techniques to work with the dog, not to ask them to do training techniques that jeopardizes their biomechanical design, please, please, please have a look at the videos, have a look at the homepage, and think about that, because it's there for you if you want it. So I hope that's helped everybody. I haven't seen much of the chat. The bite-sized courses are not free, Gemma. These webinars are free, and they take 3 or 4 days to put together. The bite-sized courses, each one of them has taken me a few months to put together. The videos have taken a year to put together, but the therapeutic handling techniques and clinic enrichment techniques are £97 each. And really, it's a steal, and they're going to be held at that till September. Canine natural balance motion, I think that's about 117 again. Just it took a lot more time. There's a lot more information in there as well. It's at a higher level, so don't jump into that if you kind of want to look at something else first. It's a stepping stone to get to. But they are amazing value, and you get full support, and you come into our canine community for free, and they're awesome. We were looking at them the other day and I forgot just how much we stuffed into them. So they're really worth that value. But again, we're going to be doing another free webinar on bite-sized canine anatomy. I hope you can join me then. Thank you so much for your time. Thank you so much for your support. I am so grateful for the emails that you have sent to me in the last few weeks. I am thinking of all of you. Please keep safe, stay safe, keep well. And I'm so excited to see this community of like-minded individuals that want to work with the dog and not on the dog. So it's just thrilling to share this information with you. I cannot tell you how grateful we are for all the emails that you send us. Thank you so much. Please do put in the chat if you found this useful. The scapulothoracic joint is the most awesome joint to get your head round. Take some time and go through the information again, and just keep safe, everybody.